So Dr. Michael graduated with a degree in biology from Columbia University in 2012. She went to vet school at UC Davis, where she graduated in 2019. And while she went at UC Davis, she really developed a strong interest in livestock medicine, and especially in small ruminants. She worked in a mixed animal practice in Oregon before she was joining us at Gold Coast Veterinary Service and Consulting in February of this year. So please welcome with me, Dr. Michael. And if you have any questions, since we are a smaller group, I think you can probably ask him while we go, or at the end, we will have probably enough time for everyone. So say hi to Dr. Michael.
Hello, everyone. Thank you for joining us on Monday night. So today we're going to talk about CAE, CL, and Johne's disease in small ruminants. Let me see if I can figure out, there we go. So just an overview, these are kind of the common 3 diseases that we'll test for on a biosecurity screen. So if you were to purchase new animals that are coming into your herd or flock, as well as kind of routine testing to do for your herd. We'll start with Johne's disease. This disease is caused by a bacterium called Mycobacterium avium, subspecies paratuberculosis. The species that it affects are cattle, sheep, goats, wild ruminants, camelids. There have been some other kind of rare reports of in other non-ruminants, but those are kind of the major species. It is a hardy bacterium, so it can survive for long periods, a year or more, in moderate environments. It is degraded by ultraviolet light, heat, and drying. This is a major disease that can cause a lot of economic losses to your herd. The clinical signs of Johne's disease, typically it's in adults, 2 years to 5 years. They'll typically have a chronic or worsening diarrhea. It typically does not contain any blood or mucus. They won't be straining. In small ruminants, sometimes they won't even have diarrhea, or they could have just kind of clumping of feces. With the diarrhea and the effects to their intestines, they can get protein loss, and that can lead to bottle jaw, which in the picture on the right of the sheep, kind of the swelling under their mandible. There can be weight loss, but they are often still eating and have a good appetite. Sometimes you might not see any clinical signs, so there can be a silent form or a subclinical form. The transmission typically occurs at a young age. The route is fecal oral. In some cases, if the dam is in the advanced stages, it can cross the placenta. In rare cases, it can be aerosolized in dust. The susceptibility does decrease with age, but there is a long incubation period. And and then they can, when different time periods that it can occur are kind of parturition, weaning, commingling of new animals, or their first lactation. And the dose of the bacteria does determine the progression and severity of clinical signs, or the time to clinical signs. To diagnose Johne's disease, the gold standard is fecal culture. However, it is very slow and can take up to 6 months to get a true negative. There are fecal PCRs, which are faster, but kind of have a lower sensitivity, so might not catch that positive disease. There is also an ELISA test with tests for antibodies. This is the most sensitive and specific in a clinical animal. It is low cost, fast, but sometimes can be more difficult to detect those early infections. Unfortunately, there is no treatment for Johne's disease, so we can only control and try to eradicate it in our herds. In order to do that, we rely on testing and culling those that we find are positive, maintaining a closed herd, so not bringing any new animals in. If you are bringing new animals in, making sure to purchase them from a negative source or testing the ones you are bringing in before they come into your herd. It's important to kind of manage colostrum so it's not spread that way. And since there is such a long incubation period, we recommend yearly testing because it might take a while for those to become positives on the testing. And so really staying up with those testings every year to make sure that it's not in your herd undiagnosed. And then making sure disinfecting all of the common areas. Next, we'll move on to caseous lymphadenitis, or CL. This is also caused by a bacterium, Corynebacterium pseudotuberculosis. It is another hardy bacterium that can live in the soil and survive for months to years, even in sunlight, so it's very hard to eradicate from the soil. The species that it affects are cattle, sheep, goats, and horses. However, cross-species infection is pretty unlikely between horses and small ruminants because they have different strains. Cattle can be a little different. They can get kind of both types of those strains. There are a lot of economic losses due to this disease as well, since it is a lifelong infection, and it is zoonotic as well. So we have to make sure to prevent that. The clinical signs, typically the ones we'll see are the most obvious, the abscesses that occur at the site of lymph nodes. You can see the goat on the right with kind of the red points of where the lymph nodes are. So those are kind of spots that are typical in CL. They tend to have a thick capsule with thick, creamy, can have greenish discharge, typically no odor, but sometimes it can look a little bit different. There are internal abscesses that can happen as well. This is more common in sheep. Typically, it's harder to diagnose. They might just have chronic weight loss as the only sign, kind of poor doers. And until we kind of either do a necropsy, you might not find those abscesses that are internally. In cattle, sometimes we'll see a skin infection, as shown in that picture down at the bottom. The transmission is typically kind of direct contact, usually through the skin, such as wounds, a lot of times during shearing. If there's coarse feed, oral abrasions, it can get through the mucous membranes. It also can go through respiratory secretions or the milk. So there's a possibility it can spread to kids or lambs through the milk. And it typically goes through the lymphatics, and that's why we see it at the sites of the lymph nodes. For testing, we can take a sample from the abscess and culture it to grow the bacterium. The other test that we can do is the She test, which tests for antibodies. If there is a high level on those results, it could mean that there are internal abscesses, a recent exposure. It could mean that they've been vaccinated against it, or it could be kind of a resolved infection. A low or normal result could mean that they are truly negative. They might just have an acute onset, and so it hasn't quite reached that high enough level of antibodies. Or it could have a very thick capsule, and so that's kind of isolating the disease, and so we're not getting that response from the body to produce those antibodies. The treatment, fortunately, there's no cure for the disease itself. We can lance, drain, and flush the abscesses to clear those and get those to heal. But the animal will be CL positive for the rest of its life and could produce more abscesses in the future and potentially spread to the rest of the herd. It's important to isolate them until they are healed, and by fully healed, even those scabs can be infectious, so making sure that it's completely healed over before returning them. When lancing, draining, it's important to contain all of that material and dispose of it, because if that gets into the environment, since it is such a hardy bacteria, then it could stay in that environment. So sometimes having kind of a sick pen where they can go to while they're healing, so we're not contaminating the whole environment where the rest of the animals are. If there are internal abscesses, those get harder to treat. They may need kind of long-term antibiotics to try and help those. To control for this disease, it's important to test any new additions that are coming into your herd or flock, to isolate those that get infected, to disinfect common tools that you're using between animals, such as shearers, common areas like feeders or water areas, to try to minimize the spread. Pasteurization of the milk, culling animals that do have abscesses or coming up positive. There is also a vaccination that can be done, which can decrease the number of cases and the severity of cases, but it does not completely stop the disease. And it's usually recommended if there is an issue in the herd, and not necessarily if you're negative or clean for the disease. So kind of only in more severe cases using the vaccination to help control the disease versus kind of trying to prevent it. The next disease we'll talk about is caprine arthritis and encephalitis, or CAE. This one is a virus, the caprine arthritis encephalitis virus. The species that it affects are goats. It is related to a disease in sheep, which is called OPP, or ovine progressive pneumonia. This also causes a lifelong infection, and there is also a delayed clinical onset after kind of exposure to the virus. It can take years until they develop clinical signs. The typical signs that we'll see in kids around 2 to 6 months typically get the leukoencephalomyelitis, which we'll typically see as a rear leg paralysis or eventually paresis or paralysis. They can have urine retention due to that. They may be afebrile, still eating and alert, but just kind of having those signs of their rear legs. In adults, usually that are mature around 2 to 3 years, that's typically the polysynovitis, so kind of the joint disease that we'll see. It has an insidious onset, typically affects the carpus joint in the arrow in the picture, and you'll see kind of chronic joint enlargement, weight loss, those sorts of signs. However, only 35% of infected goats will show clinical signs, so a lot of times there might not be anything at all that you see. There are 2 other manifestations that we'll see. One is called hard bag, which is a firm udder, kind of a mastitis, but they'll have a normal appearing milk, but there'll be decreased milk production. You might see hungry kids because they're not getting a lot of milk through that mammary gland. There is also hard lungs, which is a pneumonia that can be progressive. They might also have weight loss and or arthritis too, but may not. The transmission is most commonly through the colostrum in milk, but in rare cases can occur through direct contact between affected individuals, through fomites, so any materials or feeders, waterers pass through that way. It is possible but unlikely to happen in utero or at birth or breeding. There have been some reports of that. To test for this disease, you can do a CSF analysis. There is also agar immunodiffusion, but that one is not quite as sensitive as the ELISA, which tests for antibodies. However, kids can have maternal antibodies up to 4 months, and so that doesn't necessarily mean that they would have the disease. It could just be from the mom's antibodies that are circulating, so retesting those ones after 4 months to see if they are truly positive. As with the other diseases, there is no treatment for CAE. We can only offer supportive care, which is typically non-steroidal anti-inflammatories for the arthritis that we'll see, trying to keep them as comfortable as possible since it is a lifelong disease. In order to control it, the main thing is to prevent the spread through contaminated milk and colostrum. In order to do that, you could heat treat colostrum under 35 degrees for an hour, or just feed cow colostrum. You could pasteurize the milk at 165 degrees for 15 seconds, or kind of removing the kids so that they don't have any contact with the mom. That would require bottle feeding in order to kind of not get that spread through the milk. Isolating any of those that are positive, keeping them separate from the herd, and testing new additions that are coming into your herd, as well as routine testing within the herd. Here are some of my resources. And thank you for coming out to hear about these 3 diseases. This picture is from Halloween back in vet school of my dog sheep, since we're 1 week after Halloween. If you want to follow our adventures, we have an Instagram account and Facebook. So follow us on there. Let me know if you have any questions.
So we had one question by Kim, and she's asking, is there still a vaccine for CL, or did the manufacturer cease the production?
I believe that it's still around. I don't, Dr. Varga, do you know? Because when I was doing my research, it seemed like it was still available.
I believe so too. You know, sometimes they are back ordered, possibly because it's actually a very small company who produces that. It's Colorado Serum. So I wouldn't be surprised if at times they're back ordered. In the past, we also used a lab in Davis, and I try to remember what the lab is. You could actually produce your own vaccine. And I believe a couple of years ago, I looked into that because I heard a herd that had a lot of CLA. So in general, I do not recommend to vaccinate for CLA because it gets really difficult to differentiate between the actual natural strains and the vaccines. And I focus more on eradication and really buying animals that are tested, removing animals that are positive. However, I have encountered like a herd in Dixon that is, unfortunately, the owner loves this goat, and I totally understand that. There is babies, and we have probably 50% of his goats have CLA. So in this case, we cannot just eradicate and cull them because he has personal attachment to that, to those animals. So I do recommend in this case to vaccinate to decrease clinical signs, right? It's not going to remove clinical signs, it decreases clinical signs. It makes the life quality of those animals better. And the problem in this herd is, I'm assuming that the whole environment is severely contaminated. So we basically would have to move the goats to a different area if we wanted to work on prevention and then raise the goats differently as well. So that's my 2 cents on the vaccine. Then we have a different questions by Mary. How prevalent are these diseases in Yolo County?
So I know CL is very prevalent. We see it quite often. Since I've been here, I have not seen Johne's in CAE. Dr. Varga, do you know how often we see those?
I don't have a number on prevalence, and I don't think anyone in Yolo County really has looked into it. We know, for instance, in horses where pigeon fever is CLA as well, right? It's a different strain, though the pigeon fever is not going to go to the sheep, and the sheep strain is not going to go to horses, like Dr. Michael explained that earlier. However, we have seen that in horses, at least, that, and I think there's more research to it, that it has actually invaded more areas. And I'm not sure about YOLO, but in general, more areas of the US have actually pigeon fever problems. And that might be due to transport of horses to different areas, to contaminating the soil, contact through events and things like this. So I see a lot of CAE in YOLO. I see a lot of Yonis as well. It's not necessary how much we see, it's how much we test. If I don't test for a disease, I cannot detect it, correct? So I had encountered several herds or flocks that said, we never had an issue, we don't have it, but they didn't test for it, they don't know it. So anything that was maybe thin and sickly looking, they might have just removed it from the herd without knowing that it actually had yonis, that it actually had something else. So I think once we start testing, we will actually see way more. Johne's disease in sheep and goat is, I think, more common than people think because we are not testing for it enough. And as Dr. Michael said, it's a slow developing disease. It has 4 stages. The first 2 stages are actually almost impossible to detect on a test. And the second stage may or may not, you have a positive test like a serum antibody test or yeah, that's mainly the screening test. However, if we go to the clinical stages, which is stage 3 and 4, we get positivity in those tests. And then also stage 3 may or may not positivity in a fecal test. And stage 4, which is the clinical case where we are actually actively having disease from yonis, which is weight loss, which is the proteinemia, which is the bottle jaw subsequently to the loss of proteins. That's where we already have a lot of organism in the feces, but I don't want to test for those. I want to detect the first stages, which are difficult. And that's the reason why we recommend to test them every single year. And after approximately 5 years of testing and you're not getting any animals in, right? Then I can say we maybe want to stop testing. But before 5 years, I do not recommend to test because it's a slow growing organism. Usually we see it, 4 or 5 years of age in the small ruminants. In cattle, we see it at 12 months, 14 months of age where the clinical signs come, but cattle are different than sheep and goats. In severely contaminated herds, I do see it actually at the age of under a year. I have detected Johne's disease in 6-month-old does. There's nothing I can do. The environment is so contaminated, and it's just the only option is to cull the animals, to remove them from the premises, to start off new. But that one, for instance, was a really large herd of thousands of animals. Just impossible, A, to test everyone, and B, to remove them from the source. So we just need to deal with what we have. I'm not sure if I drifted off a little bit with the question, but going back, I don't think we have a lot of data how much, but I see it in Yolo County for sure. Then we have another question. Can you explain the transmission types for CL? Back to you, Dr. Michael.
So typically it occurs kind of between direct contact. So any animal that has an abscess that has possibly ruptured, that gets into either the environment or directly spreads to another animal. The other animal might have kind of a cut on the skin or an abrasion in the mouth, or it just gets on the mucous membranes and can spread that way. So typically at shearing, when they're shearing and they accidentally kind of nick an abscess and they go on to shear the next animal and get a cut from the shearing, and then it kind of spreads that way. So disinfecting like the shearers in between animals, or if there is an abscess that they notice on one, then definitely after that one. It can live in the environment for so long, so they might just pick it up directly from the soil. Or in some cases, not quite as common, but it can be spread through the milk to the young, to the kids and lambs that way.
And actually, there is a study or a case report that humans got infected with CLA because the I think it was a doe sheep. I might be lying right now. I can't remember. I read it a few years ago. There were abscesses in the udder. The CLA was going into the milk, and that's how the babies get it too, right? Through the milk, there are some abscess or bacteria spread into the milk. And humans, especially if you do not pasteurize the milk, and we see a lot of more organic farms or natural farms, people who are just drinking from their own animals, but they don't test them. I'm a little bit concerned about that one, because you could potentially ingest some of the CL, you could get some mild fevers or other diseases with that. It's not that common, but I certainly recommend to have your goats tested if you drink your milk unpasteurized. If you consume it yourself, not only for brucellosis, but I also would check for, CLA. I usually even recommend a milk culture, probably every month, just to avoid that we have something. And that's something you can even take yourself and submit it if it's on a monthly basis, but certainly that's something to keep in mind. So there is the transmission is basically oral. They can inhale it to a specific degree as well. Not oral, probably not as much, but it could be as well. And then in uterus, they can get infected in through the milk. And then we have another question. How long do you recommend the quarantining new animals and that you may be introducing to a growing herd?
So, ideally testing them either before they come onto your property, or if you have an area that they can quarantine in, and testing. So we'd want to wait until we get those test results back. Typically kind of a minimum of 2 weeks, but generally kind of up to like 4 weeks, just for parasites and other issues as well, just to make sure that we don't get any diseases during that time. It does get hard when some of these diseases have a long incubation period and might not, they have that length of time that's longer than 4 weeks. So it can't be 100%, but generally it's kind of 2 to 4 weeks.
So with Johne's, it's difficult, right? Because if you would test an animal or you buy a doe kid and it's just like 4 months old, what are you going to do, right? The previous herd is not testing, they're not on a testing regimen. How do you figure this out? So in those cases, I do recommend to test at least the mom and the dad of that herd. So my minimum database is testing them for Johne's, testing them for CLA, and CAE, just so that I have a baseline. If they're already positive, I'm not going to buy that animal. I'm sorry, but that's not going to happen, right? If they're negative, it doesn't rule out that that kid or, lamb couldn't have Johne's disease, right? Because it's a slowly growing disease. So those kids I do test actually before they're a year of age already, even though in general we say it makes no sense to test them beforehand because it's a slow growing organism. So, but since I don't know what's going on in that herd, if I don't have a relationship with them, if they're not testing on a frequent basis, I do recommend to do it early. And the problem is we cannot always rely on those test results either. So you have to take it with a grain of salt. I had I had the great idea to breed baby doll sheep. That was the worst financial investment I ever had, I think. I just lost money on this adventure. So as much as I love baby dolls, I'm not going to touch them ever again. So, but I had these lambs I bought and I tested them, I think because they went to a different farm to be fed. And I didn't want to introduce something to some pet animals. And I thought, you know what, they're now 9 months old. I'm just going to test them anyway, because you know what. So I tested them and 2 of my baby doll sheep came back positive for Johne's. I tested them 4 or 5 times with 2 different labs, and those 2, came back positive. One of them was my favorite, really skittish little black devilish sheep, but I loved her, right? So I decided, for the sake of my farm, because I also had goats and I had cattle and other things, that I will put them down. So, and I put them down and had a necropsy performed on both of them, and they were negative. So you have to be sometimes a little bit careful in those things. But for me, it was important to not have it, not introduce it. So even though they came back negative, I still think it was the right decision for what my goal is or was, a free herd. I couldn't take the risk. In those cases where we don't have a known exposure, we don't know that there's any clinical Johne's cases in the past, I do recommend now to be more cautious, to isolate them maybe for a few months and retest them. Fecals, I did run on those guys fecals as well as blood. So I do recommend then to watch it. But I would always consult in those cases with your doctor, with your veterinarian, to see what is the best way of dealing with this problem now. Because once you have it on your herd, in your herd, Johne's disease, it's extremely difficult to get rid of. Extremely difficult. And one of the things Dr. Michael said in the presentation for prevention of CAE, cow's milk is great to use, but test the cow for Johne's before you use the cow milk, because you maybe don't get CAE, but 20% or 25% of the dairy cows in California are infected with Johne's, if not more. That it's a huge problem. Go down the list. So we have another question here from Mary. For a small herd, less than 20 animals, are individual tested or is a combined representative test effective for surveillance, and can the environment be tested? Back to you, Dr. Michael.
So I would always recommend individual testing. That way you can kind of pinpoint the one that might be affected to find those diseases in your herd, because without kind of taking a smaller sample, you might be missing the ones that are positive. So there's that risk. Unfortunately, I don't believe there's any tests to do for the environment. And so it's hard to know if other goats or sheep have been there that might have had these diseases like CL or Johne's that could be spreading without kind of a history of previous ownership or previous animals being there.
I think what I did in the past, we picked up poop sample that was dried out and sitting around on that pasture from whoever was on there, and we tested it with a PCR for Johne's to see if we find it, and we have done soil samples too, just to try to find something. And we didn't, but that does not necessarily mean that there's nothing, because it's a huge pasture, little poops here and there, what are you going to do? So the best is probably, if you buy new property, to see if there were any sheep or goats on there, or cattle, and if they were, maybe try to put them on a horse pasture first for a year or so before you move them over. I think, or even 2 years. I think with the heat in California, especially if you're in a drought, it's kind of nice because it kills more than in a moist environment. So you have better chances of just maybe a year, and it should be okay. So that would be something. And then for less than 20 animals, I certainly would say individual testing is advised, because if you breed them and you sell those offsprings, what I used to do is I included my testing fees into my sales price and use that as an advertisement as well. Because you can actually say you test your animals, and after a while you can say, I'm testing my animals for X amount of years and I never had a case. That is a biggie, because you need to educate your clients of what they're actually getting into and why your animals are actually better than someone else's animals. Yeah, they're selling the goats for $150 on Craigslist. Okay, but you don't know what you're getting, versus if you're selling them with a higher price that includes the testing, that you sell quality animals to someone, and you can I personally, when I was breeding goats, and I never got to breed my baby dolls, I gave up. But when I bred them, at least I knew they're going to be healthy animals. They're not going to die of CLA, CAE, or Johne's. You know, at least that gave me some guarantee as well. And so you can ask for more to cover those costs. And usually after the first, I want to say 2 years, you can drop the CAE and CLA if you don't get animals out of, you don't take them to shows, or you don't get a new buck or something like this. Or if you even get a new buck, make sure you test them prior to coming to your farm. And then usually I test them, anytime after shows too. And then we have another question here. Is it best practice to see test results before saying yes to adding individuals to the herd?
Sorry, missed that one. Yes, so that would be the best option to wait to know for sure that they are negative, because then if you don't, you're taking on that risk. If they are positive for one of those diseases, are you willing to kind of either quarantine them, wait to do multiple rounds of testing while keeping them separate from your herd to see if maybe it was a false positive, or what you're going to do if they are negative? And so if you're waiting and getting that negative result before you get them, then that's just one less thing you would have to worry about.
So I had it a few times when I bought animals that people were basically telling me they don't want to test because their animals never had issues. I do not buy those animals. If someone refuses to test, and I usually as a buyer even take the cost, so I offer it, I will pay the veterinarian to go out to your farm, take the blood and pay for the testing. I didn't make it a problem for them. And they refuse, I do not buy the animals. It has to be transparent when you buy something, and then buying it and testing it at your place, that creates a lot of problems, because then you may have Johne's positive animal already on your farm. What are you going to do then? A, you invested some money, B, now you possibly contaminated your soil, even if you guarantee them, and then you have an animal that sure, you could take it to the market and sell it, but I think it's not ethical once you know what it has. At least that's my opinion. That's why, I could have maybe sold my baby doll sheep again, but I decided not to and just suck it up, But that's why I want you to test beforehand, because I don't want you to be in the position that you have an animal you already invested in, and then it doesn't work out because it is diseased. Or, if you buy a pet, it's even worse. If you buy a pet goat, most of my goats were actually pets, and you buy a pet goat and you fall in love with that thing after just a week, right? A day, actually, it doesn't take even long, 10 minutes. And then it has something, what you're going to do? So yes, testing prior to purchasing, or even, when I was a little bit younger, I'm still young, but I had always those bummer calves, bummer lambs, anything bummer was in my house, right? And then once I started seriously breeding, I stopped with that, because I just couldn't take the risk anymore of taking animals and I don't even know what their status is. And so I just said no, and that's important. If you have a closed herd, if you're testing, start testing. If you start testing, that's what I tell my clients usually is, you're committing now. If you just do one-time testing and that's it, don't even start testing. If you start testing, this is a commitment for your herd, for your flock, and you should continue with that. You should know what your goal is, and the goal is a free herd, then we're going to work on that, but you're just like, yeah, I just want to see what's going on, Well, we can test, but it's not going to help you out long-term, if that makes sense. Okay, we have another question, and that is, what is your opinion on the theorized association between Johne's disease and Crohn's disease. And then there's like some literature seems to imply that Crohn's might be caused by the same bacteria may come from the milk.
Yeah, so there's been a lot of discussion kind of due to the similarities of these diseases, Johne's and Crohn's disease in humans. There hasn't been quite the research to kind of really link them together, but it is interesting how similar there are. And so it would be definitely, I would like to know more. Hopefully they can do more research to see if there's a direct link between them. I don't know if I have a specific opinion on it, but it is, they do seem like similar diseases.
Yeah, and then we have another one by Kim. I'm curious about zoonosis with wildlife. For example, is Johne's species specific or can white-tailed deer transmit? And this would include CAE and CLL.
So I believe for Johne's, I think there can be cross transmission between wildlife and domestic animals. I know, I think there have been areas where like elk and cattle kind of commingle, and both those populations have Johne's disease. I'm not sure how common it is, but I think it is possible for Johne's. I don't think there's a kind of species specific type for them. For CAE really is in just goats, so I don't believe any whitetail deer or any other animals would have that one. CL, I mean, it has that species specific component. Not sure about wildlife with CL though.
I don't think we're really worried about that much, you know. No, it's more potentially the Johne's, but like you said, but I don't think CAE or CLA would be really causing an issue.
Yeah, I was mostly curious because we do have we have elk and lots of white-tailed deer that come through. And I know, there are certain nematodes that we have to be concerned about. And then I just wasn't sure. I haven't delved into it. I haven't like done any searches yet or anything and gone on to PubMed and, tunneled down to find out a little more about it. But so I was just curious. Thank you.
Yeah, it's a very good question. I think we can look into that a little bit and see what we find. Truthfully, I don't think I heard much about it in transmission wise, when we're learning or teaching about it. So I don't think it's a huge problem.
Well, I think mostly too, and mostly in California, and this is just as pertaining to goats that we purchased in California and brought here to Montana. So, so it's completely different.
Montana. Yeah, that makes the difference with the elk, but yeah. No, usually CLA I think is not really an issue in them.
Okay.
And even if they would have an abscess, since they're moving so much, and I don't think they will spend that much time on your pasture, so except you're really feeding them, I don't think it's a huge risk, to be honest.
Okay, great, thank you.
And then Lisa asked, is Johne's what they call chronic wasting in deer and elk?
That is a separate disease. The chronic wasting disease, I believe, is caused by prion disease, and so that would be something else. Yeah, and actually Fish and Wildlife, and they renamed it, and I don't remember the renamed name because I can't remember things anymore, but they just started a new study as well in California looking into do we have actually chronic wasting disease in California. I believe we have it in Montana because there was just some eradication programs going on last year or the year before, where we had herds that were infected and they were just destroyed.
That is a federal program that helps, destroying those diseased animals because there's no cure for them. And it can be widespread in the herd. So we try to mitigate the spread of the disease. So anything that, for instance, get killed in Nevada comes into California. I think they're trying to test those animals. We are so far chronic wasting disease free in California, as far as I know, but not every other state. So there are some stations where we are increasing testing to avoid that it will come to us, but it's not related to Johne's. They're very different. One is bacterial, and like Dr. Michael said, the other one is a prion disease, just like BSE in cattle that has been eradicated in Europe. And in the US, I think we only had 6 cases, and 2 of them were Canadian, I believe. And there was, most of them were actually not the transmissible form anyway. It was just a mutant. So just very different.
Yeah, I know there's it's pretty prevalent in Montana. In fact, they're, they have different stations. So basically, if you harvest an elk or a deer, you are to have it tested so that they can screen, they're basically just doing screening to see where it's most what counties it's most prevalent in.
Yeah, that's good. All right, I think we are coming to an end here. Yay. Do you guys have any additional questions? Because we have another 5 minutes and then it doesn't seem like. So I would like to say thank you to Dr. Michael for the great presentation. If you do have any questions, you can always email us or contact us. I sent you a link. We start now with the telemedicine appointments too, which is kind of cool because we can help in Montana or wherever you guys are. There are some limitations to this because we cannot prescribe legally medications or so, but we can help with herd health related questions. So, so I sent you the link and you are welcome to book an appointment because we have a few free ones. So it's free of charge. And then we will hopefully start doing the webinars with also guest speakers. The plan was, Dr. Michael helped me out here. The plan was every second Monday of the month. I don't remember. I'm getting too old.
Something once a month, but
yeah, we want to do it once a month. We will send out an email and let you know, or follow us on Facebook and Instagram, and it will come up there as well. All right. I appreciate everyone's time and hope to see you soon.
thank you all for coming out.
Bye.